of how many we've done all together since April. I know many of you have joined lots of the webinars in this series, and we're really grateful for your participation and great questions. Today, we're going to look at how COVID has impacted state government and services. I'm Tara Britton. I'm the Director of Public Policy and Advocacy with the Center for Community Solutions. We're a nonprofit, nonpartisan organization that works to improve health, social, and economic conditions through research, policy analysis, communications, and advocacy. You'll see here our recently updated, actually, policy priorities on your screen. So you can see we cover really lots of areas in the health and human services space. And I've just found it so incredibly valuable to hear from so many folks across the state and our communities working on the ground in health and human services, really explaining to us how COVID has impacted everything that they do, everything we all do. This month, we've really taken a close look at how COVID impacted kind of what the budget scenario looks like. And last week, we talked with representing entities at the local level to really explain what that looks like on the ground. This week, we're very grateful to have three esteemed speakers talk with us about the impact that COVID has had on state government and services, and kind of looking at the budget there. So I am going to turn it over to my colleague, Kelsey Bergfeld with Advocates for Ohio's Future, to say a little bit about AOF and introduce our speakers. Thank you all.
Great, and thank you so much, Tara. Good afternoon, everyone. As Tara said, my name is Kelsey Bergfeld. I'm the Coalition Manager of Advocates for Ohio's Future. We are also a nonprofit, a nonpartisan coalition of a really wide range of health and human service policy, advocacy, and provider organizations from across the state and local levels. We really work together to make sure communities and families have what they need in terms of resources and programming and support from the state and local governments to succeed and live really healthy and successful lives. So like Tara said, I'm really excited to introduce our three presenters this afternoon. We'll have Dan Baker joining us from the Ohio Office on Budget and Management, Kara Burke-Wente from the Jobs and Family Services Department at the state of Ohio, as well as Susan Yeagers. She's the director of the Ohio Poverty Law Center and also serves as a leadership member of Advocates for Ohio's Future. So when Dan, I think you are up first. Whenever you are ready, please start us off.
Okay, well, thank you all for having me today. As was mentioned, I am Dan Baker. I am a Deputy Director at the Ohio Office of Budget Management for Budget and Planning. So I'm just going to talk today a little bit on the impacts that COVID-19 has had on the state budget. We can start with the first slide. So what you have here, and I could have chosen any of 100 different slides that look like this, but this just kind of shows how historically large the drop in the second quarter was. This is in terms of GDP. This is the US GDP, and this is from the Bureau from Economic Analysis, but it also appeared in our monthly financial report. Literally they needed to resize this graph. As you can see, and if we went back further in history, it would be the same thing. I mean, we've never had anything like the second quarter drop that we had. It's over 30%. As a comparison, you can see the previous large drop was during the Great Recession, and that was under 9% back in 2008. So, we are really dealing with unprecedented circumstances right now. Most folks are projecting a pretty solid rebound in quarter three, but it will still take several years based on most projections to kind of get back to where we were. We can go to the next slide. So this is just kind of fiscal year 2020 in review. So as you all know, this COVID-19 really hit us in March, which was the last quarter of the state fiscal year. But the second quarter of the calendar year. But through February, we were actually having a very good year. We were about $250 million above our estimate, and then the bottom fell out. We ended 2020, tax revenues were 1.1 billion below the estimate. Approximately half that, maybe a little more than half, was related to moving the income tax filing deadline from April 15th to July 15th. Ohio's fiscal year runs from July 1st to June 30th. So that action moved the income tax deadline out of one fiscal year and into another. So that had a pretty large impact, which we'll talk about later as well. But so we missed target by about 4.6%. And year over year, we were down 860 million or 3.7%. To close this hole, Ohio is required to have a balanced budget. And so the governor issued an executive order last year, and he reduced state revenues by 775 million. Most of that came in funding to our primary and secondary education system, as well as higher education. While we did face severe tax shortfalls, they were slightly better than we had anticipated. So we ended fiscal year 20 about 191 million better than our internal projections. And this money rolled into fiscal year 21, which is the fiscal year we are in now, and it started July 1st. We can go to the next slide. Thank you. So now looking at fiscal year 21, in June, well, taking a step back, the executive order that was on the previous slide, the Governor DeWine required OBM to project, and the Department of Medicaid to project tax revenues and Medicaid caseloads for the fiscal year to update those. And based on that, we came up with a projected shortfall of 2.4 billion in fiscal year 21. So then OBM issued guidance to state agencies earlier in the year. Essentially, we shifted amounts into holding accounts, which can't be spent until OBM releases them. They are not yet reductions. The appropriation is still there, and they are just kind of sitting in a holding account that can't be used yet until either they are released or turned into a reduction. There was a news article, I think it was earlier this week or maybe last week, in the Dispatch. I believe the headline was, Governor DeWine taking a wait and see approach on the 21 budget. And I think that's right. My last bullet here is that through the first 2 months, July and August of fiscal year 21, the total tax receipts are above estimate by 253 million. And these are not our revised estimates that were incorporated in the 2.4 billion. These are the original House Bill 166 estimates with the income tax shift factored in. So these are the higher estimates, and we are still beating that figure. So at this point, we're just kind of, again, waiting to see what September brings, and then we will likely reproject or reestimate what we think tax revenues are at the end of this year and kind of see where we are then, whether we need to move forward with cuts or if we could potentially release some of the money from the holding accounts. Next slide, please. So again, where we are now, if you ask an economist, 100 economists, a question, you're going to get 100 different answers. So the answer to where we are now is we really don't know. Like I said in the previous slide, we are currently $253 million in tax revenue better than we anticipated 2 years ago pre-COVID. July this year, in terms of non-auto sales tax, was the highest collections that we've ever had. So, essentially that means July was the biggest month in terms of car sales in the state of Ohio history. That doesn't really make a whole lot of sense given what's going on. But I wanted to put this chart up. It kind of shows that there are really two recoveries going on. As you can see, the green line are high wage earners, those making 60,000 or more. And this chart is from a website called Tracking the Economy, run by Opportunity Insights. And then the dark blue line is low wage earners who are making less than 27,000, and their employment is down almost 10% from January. So while high wage earners and those who are capable of working from home, their employment really hasn't changed much, and middle class is down a little bit, but not a whole lot. It's really the low wage earners who are, I think, struggling the most. Also, one piece of information that came out today was the unemployment report. August was essentially unchanged from July in terms of the unemployment rate. It was 9%, and then it went down to 8.9. So some of the gains we've seen in previous months seem to have slowed. So there's just kind of a lot of conflicting information out there right now in terms of where we are now and how that bodes for the rest of this fiscal year and the next couple of years. I think the consensus is that, as I said earlier, it will take several years, probably. So we are currently in fiscal year 21, state fiscal year 2021, and it'll likely probably be the end of fiscal year 2023. So that would be like June of 20. Well, it'll be about 2.5 years from now that we get back to normal levels. You can hit the next slide, please. So as I said, the state tax revenues are up about 250 million. There are a couple of reasons we think that this is happening, although we don't have any definitive answers. One, there was a lot of pent-up demand from the second quarter, and because people couldn't go out, they couldn't shop, they couldn't buy things. So we think that, to some extent, money was burning a hole in people's pockets. So when they could go out, they did. But also we are seeing consumer spending habits shift. So Ohio, really, our sales tax, we don't really tax services as much as we do tangible items. So we think that people are shifting from services and doing things to home improvements or buying bicycles or kayaks, those types of things that are taxed. So we think that that is at least partially responsible for the strong sales tax information we've got. One other piece is just the economic stimulus. The $600 for the unemployment, the increase, the weekly increase went away at the end of July. So we really think that September, that we think will have worked its way out of the economy in September. Now, I believe the new $300 boost is supposed to go out this week. So that will have an impact as well. But it's kind of hard to tell with all this money coming in and going out, what'll happen. But when it all goes away, and also Congress is kind of going back and forth right now on a new fiscal stimulus package, and doesn't look like anything will happen until after the election. But both versions have included a continued increase in the unemployment compensation, but it's different amounts. What I'm trying to say here is that when all of this goes away finally, there will be some sort of disruption to the economy. We will hit a speed bump again, and it will provide headwinds in that this money will no longer be in the economy, and particularly those on the lower end will face some difficulties, and that'll put some pressure on the statewide economy and state tax revenue. Next slide. And this is the final slide, just kind of a preview of going into the next budget. So Ohio has a biennial budget, so that means a 2-year budget. Our current budget, as I've said, we are in fiscal year 21. This runs through June 30th of 2021. So beginning early next year, the legislature will start to debate the fiscal year 22-23 state operating budget. But OBM is already at work on putting together the budget for next year. We have to have it to the legislature in February. And so we've started the process of underway. Some of the smaller boards and commissions, they had to have their submissions into us this week. And then the larger state agencies have to have their budget recommendations to us in mid-October. So over the next couple of months, we will be putting together the state the next budget. Part of the problem is we still don't know where we're going to end 21, as I've just spent the last few minutes talking about. But one of the challenges is fiscal year 21 does have some significant problems even before we've have decided whether we want to use any of the rainy day fund. As I mentioned earlier, the income tax deadline was shifted from April to July, and that brought about $600 million in one-time income tax revenue to fiscal year 21, which will not be here 2 years from now or next year. That is a pretty sizable year-over-year increase. So, even in a normal year, 600 million is a fairly tough number to hit in terms of income tax, just natural growth. Also, we have restructured some debt service that saved us about 400 million this year. And instead of taking that savings over time, basically it's like refinancing your home. The interest rates are really low right now, so we took advantage of that to lower our payments. But instead of doing it over 20 years or so, which is the term of the debt, we've taken it all up front. And so we are realizing that savings of $400 million in this year. We will not have that savings next year. So two of those together, that's about $1 billion that we'll need to make up. And then it is also, so part of the CARES Act was an increased federal match in Medicaid. It's called the Enhanced Federal Share, or EFMAP. So that has put, it's somewhere around $100 million a month in state GRF benefit that we get. So I just conservatively put $1 billion in fiscal year 21. And when I say 90% of that is attributable to recurring caseloads, that does not include the new people who have come onto the Medicaid program due to COVID-19. There are millions of people who are just on the program normally, and the enhanced FMAP lessened the amount that we needed to pay for those people. And so that will be a recurring cost in the next budget. So, before we use any BSF in this year, or anything, we're facing some challenges into the next budget. As I said, the agencies are going to have to present their budgets here in the next month. And the guidance that we sent to them in July, essentially we asked for two scenarios, one at 100% of the withheld level and then 90% of the withheld level. So that was their 21 appropriations. And then, as I said earlier, we have put some of that money in the holding account. So that would be their total appropriation minus what is in holding. And that is the end of my slides.
All right, Dan, thank you so much. Kara, you are up next, so please begin when you're ready.
All right, good afternoon, everyone. As Kelsey said, my name is Kara Wente. I'm the Assistant Director at the Ohio Department of Job and Family Services. So I'm over the Health and Human Service side of the house. And that includes child support, children's services, and then the Office of Family Assistance, which houses our public assistance programs. Over the next several slides, a couple of things that I'm hoping to cover include our COVID-19 response, which come under these program headings that you see in front of you, but a couple of pillars to keep in mind. So when we looked at COVID response, we looked at safety and social distancing, we looked at food insecurity, housing, and then supporting our essential workers, and then moving that into supporting our workforce as a whole. So with that, I will jump in. If you can go to the next slide. I'll start with supplemental nutrition assistance and the P-EBT program. So when I talk a little bit around safety, when COVID hit, our director likes to call it the COVID house. And she says, you know, all of a sudden we just had this kind of COVID house dropped on us and our whole world flipped upside down. And one of the things that I have learned over the last 6 months or 180 some days since we transitioned out of the office is that state government actually can be very agile and very nimble. And I think I would even add that we're quite resilient at this point. When we started to talk about moving our staffs home and realizing that we weren't going to have any office interactions that we were used to, we looked at leveraging our federal waivers. And as a result, our team and our SNAP policy area leveraged 13 waivers from March to now, some of which have expired and some of which we just recently got approved for. And they ranged everywhere from delaying our recertifications and our interim reports to assistance with dropping quality control rates for March, April, and May, to looking at a different type of staggered issuance as a result of trying to level that caseload back out, from delaying our recertifications and our interim reports for 6 months. I'm not going to go through each one of these, but with each one, it really was they were leveraged because we wanted to streamline administration where possible to ensure that we could, as much as possible, safeguard our clients that depended on us, and that we were making the best decisions to balance program integrity with the current circumstances of having our workforce transition within a matter of weeks, and to really be living in a new world, both from the professional and the personal space. So if we could go to the next slide. When we move into the food pillar and talk about food insecurity, we had a couple of options that we could employ to try to get more benefits in the hands of our clients. The first one we talked about is emergency supplements or maximum allotments. You hear it talked about 2 different ways, but since April, we have been able to leverage this option through the federal government, which allowed us to ensure any individual receiving SNAP benefits receive the maximum amount. So we know that on average, every month, over 400,000 families received additional benefits as a result of this policy change, which equates to almost $480 million in food benefits going out the door that wouldn't have prior to the pandemic. We know that in September, we will also be issuing this mass supplement. We got approval early in the month, and those benefits will again be going out the last week of the month. And right now we're just waiting on guidance for October. We're hopeful that because it's the start of a new federal fiscal year, our federal partners are evaluating if they have the authority to move that forward. But of course, if it's available, we will be applying to try to once again do those maximum allotments. The second piece of work we did in this space was the Pandemic Electronic Benefit Transfer Program. And this was a really coordinated effort between our local partners. We know a lot of you on this webinar today helped work with school districts and families, the Ohio Department of Education, and then the Ohio Department of Job and Family Services. So in this, we were able to look at the number of days the kids were out of the brick and mortar school buildings and used the reduced, free and reduced lunch rate to issue that amount on their SNAP card or to issue it on a new card. And as a result of that work we did in the spring, we were able to issue more than $261 million in additional SNAP benefits to over 872,000 children. Just a few short weeks ago, our federal partners opened up another opportunity to do a second round of P-EBT. Most states did not elect to move forward with this option, primarily because the data is just really hard to get. There's no central source for the data. So we actually had to work with the local districts and the management council to try to gather the data on an individual student basis, because not only do we need the child's school district and their address, but we also needed to know exactly how many days they were out of that building. So when they were in a 100% remote setting, that was a little easier. The one change in the second round was specific to districts impacted by the hybrid learning. And that was that if they were out of the district for more than 5 consecutive days, they were eligible, but we had to do it on a per day count. So I'm excited to say we have been working with the districts over the last few weeks, and ODE, they had just submitted their final data file to the Management Council for kind of data cleaning, and that we are anticipating getting that file tomorrow with the hope that we can then set up our files as we need, do the appropriate testing, and by the end of next week, issue. Right now, our best estimate is really between, I should say, between 80 and 90 million. You'll see on my slide, I say 86. That it makes my staff very nervous because that is our initial estimate, where we gauged that we thought we'd have about 490,000 students that would be impacted by this second round of P-EBT. And again, those are only schools that are in 100% remote learning or in that hybrid environment. There is no application because it's all done off of the free and reduced lunch program. And the point we realized is that with working with ODE, we know about 30% of districts are 100% remote, but they are in our largest metros where we have our most students. So you'll see that we issued about 872,000 in round 1. We're anticipating 490,000 in the second round. And I just heard right before this meeting that it's likely going to be closer to 500,000. So excited about that work moving forward. The last component I highlighted on this list was the Disaster Household Distribution Program. We were very fortunate through our work with the Ohio Association of Food Banks, this administration, our federal partners, that we were able through April through mid-June to capitalize on the Disaster Household Distribution Program offered by our federal partners, which allowed us to streamline eligibility. And it really goes back to that safety component. It allowed us to not have to handle those applications and have the back and forth between the individual going to the food bank and the volunteer or the staff person that was then trying to confirm eligibility. So that was the kind of rounds out this slide. If we can move to the next one. It moves us into the TANF space. And as you all know, we do a lot of different work with our TANF funding. And we were able to give some flexibility to our county partners to leverage some of the existing funding they had in kind of the wells, if you will, to assist with COVID response. But that was already existing resources, where we saw some new resources go out the door in the food space. Late in the fiscal year, we issued just over $4.9 million to the Ohio Association of Food Banks to purchase supplies and safety equipment and personal hygiene necessities. And again, that was really with the focus of ensuring that those volunteering in our food banks and those working in our food banks could maintain safety and social distancing. Additionally, we had 2 executive orders, one for $1 million and one for $15 million that went to the Coalition on Homelessness and Housing in Ohio, or COHIO, specifically to target rapid rehousing and transition housing. And this was really to begin combating some of the work we knew was ahead of us, even with evictions being on a moratorium. So we have been working with COHIO. I know they're doing a great job partnering with their local agencies, and our county partners are bringing up great ideas around how we can ensure that there's not duplication. And we're excited about the work that's getting underway in this space too. The next slide actually transitions us into our childcare space. So you heard me mention one of the pillars being ensuring that we're supporting our essential workers, and then also being able to support our workforce in Ohio. And that's really where childcare came in. I highlighted these changes just so everyone could see the number of times we've adjusted policy. We have stood up new licensures. So you probably are well aware of this. I'll run through this rather quickly. But back in the middle of March, even before we transitioned out of the office, we knew that we were going to have hospitals and medical staff that were going to need care that they probably didn't need in the past. And we launched what we called the Temporary Pandemic Child Care Program. And this allowed us to have a streamlined approach to standing up new programs to care for those essential workers that were out there supporting us from the safety perspective and the health perspective. We launched those just in time to actually close all child care programs under a regular license on March 25th. So those temporary pandemic programs were the only programs we had open from March to the end of May. At the end of May, we reopened under our regular licenses for child care, but we did it with a reduced class size and ratio. So no class had more than 9 children, and in our youngest classrooms, we didn't have more than 6. Last but not least, just a few weeks ago, with so many schools going to remote and hybrid learning, we had a lot of school-age children that needed care during times they wouldn't typically in the fall. And that was a difference for us because our federal law actually says that we can't pay for childcare for low-income individuals during a regular school day. So we had to partner with our federal partners again to look at that interpretation, see what flexibility we had, and then we had to secure funding to ensure that we could cover those increased hours. In addition to that, we knew that there were several programs that were going to need to be stood up to support these children where their parents couldn't have them at home because they were at work and they needed a safe place to go and learn. So on August 25th, we launched our temporary pandemic school-age child care center license. And I can give you an update on kind of where we are as we move to the next slide. So through all those changes, we did several things to try to support the child care industry. From March to May, we actually issued closure payments to 4,974 programs that totaled more than $131 million. And this was supported through the Federal CARES Act funding that we received to really our federal partners were pushing us to say, ensure you don't have an access issue when programs open back up, when your workforce opens back up. They knew that one of the critical junctures of having a workforce kind of thrive was to ensure that parents had a place for their children to go when they had to go to work. Those closure payments assisted us in ensuring that we would have programs still around when we did reopen. From the next step, we went to the child care program, the temporary pandemic child care programs. And this is where these programs were really targeted at serving our essential workforce only. We wanted to keep our numbers low. We wanted it to be only if you couldn't find another safe place for the child to be, where they could be 6 feet apart and not in a group setting. We did license 1,915 programs during that March to the end of May timeframe. And we actually supported our low-income essential workers by paying their child care, which totaled just almost $36 million. When we reopened child care at the end of May, you heard me say that we did that at reduced class sizes and ratios. And of course, that meant that child care programs that had set up their business model, that were banking on a certain number of kids being in their programs, weren't going to be able to realize those numbers. But they still had the building, they may have had the staff, they certainly had the supports that they needed to stand up those programs. So we have created a grant support program. And you can see in June, over 3,500 providers benefited from that grant program, and that totaled over $29.8 million in issuance grant supports. So we actually have continued that. We've tailored each month those grant supports to look a little different. In August, the biggest transition happened when we said, you can reopen, you can go to that normal class size, that pre-COVID class size, but if you do, then you're not eligible for the grant support because you've elected to go back to your pre-COVID business model. Those programs that decided that they needed to maintain the lower ratio in class sizes actually were eligible for the grant support as long as they committed to reducing the ratio for August and September. In addition to the ratio support out of these grants, we also created smaller grant opportunities for the programs to get COVID supplies. So they could apply to get dividers to keep kids separated, hand sanitizer, gloves, thermometers, and things of that sort. The last item is our temporary school-age license. You heard me mention that we just stood this up on August 25th. As of the 16th, we had 23 applications for these new programs with 5 approvals. The rest of them are all underway. It's finalizing documentation and getting records for some of the staff. But again, we try to streamline the process to make sure that while kids need these programs, schools already started, that we can continue to work with the heads of these programs, the administrators and owners. And I wanted to mention some of the work also, shifting gears to another office, is our Office of Families and Children in the Children's Service space. During the pandemic, we knew that children that were about to age out of foster care likely didn't have the same resources and services that they were planning on when they were going to age out. So we actually created some flexibility in this space to have a no aging out policy through, I think it started through June and then got extended to ensure that children had the best path forward. If they needed to stay in that current situation, they could, because maybe their housing had changed or their support services or their employment had changed. We also shifted during the pandemic to virtual visitations. And this was a huge change, right? So we have supervised visitations, we have regular visitations scheduled with parents, and typically those are not virtual. And we've actually learned a lot from this process, as we have with all of COVID. But one of the more promising things I heard from several counties, and they had heard from their families, were that when they were just starting those visitations, sometimes it helped them grow in confidence to do the first one or first two virtual. They were all very excited to get back to in-person when that's been possible. But it was nice to hear something positive out of these learning experiences over the last few months. So I did want to share that. Also during this time, these rules are no longer in place. But at the beginning of the pandemic, we were incredibly concerned that our residential facilities were going to fill because kids wouldn't be leaving, new kids would be coming in, and that we weren't going to have a place for children. And I can't say that has not happened across the board, but we did try to stand up the opportunity to immediately and quickly stand up new facilities if necessary. Fortunately, we didn't have to leverage these rules, but again, it allowed us the opportunity to figure out what would it look like to streamline, and what if we did need to leverage this service, how could it work? So that, I think, was a success in our COVID planning. I'm going to shift now from kind of what has happened and where we're at today to what we anticipate moving forward. If we can go to the next slide. So on my last slide, you heard Dan talk around the budget. You know that it's going to be a tough year and a tough budget year, as we're anticipating some shortfalls and moving forward in that space. But what you can see from JFS as priorities is not going to change. We are going to continue our COVID recovery. We are going to continue our benefit bridge work. This is some work around the benefit cliff that we're excited about, that hopefully you'll hear more about in the next couple of weeks. We are going to continue to implement our Family First Prevention Service Act, which is around kinship and creating qualified residential treatment programs and implementing prevention services, and really shifting some of that culture from reactive to proactive. We are going to quickly have the Children's Service Transformation recommendations. We anticipate having those by the end of, actually in November now. Everything kind of shifted as a result of COVID, but those recommendations are going to be coming hot off the press in the next few months. So that we know will be included in our upcoming budget submission. Obviously from the child support side, because they're doing some major system work, that work is underway now. They're still on target, so that's good. And then we're also continuing the work around the moving child care into Ohio benefits. That would be the fourth program. So Medicaid, SNAP, TANF, and then also child care in the integrated system. With that, I know I gave you a lot of information, but that was my last slide.
Kara, that was wonderful. Thank you so much. Susan, you are our last speaker, so whenever you are ready, please go ahead and begin.
Okay. Thank you, Kelsey. Thanks to Advocates for Ohio's Future and the Center for Community Solutions for hosting this series of webinars and inviting me to participate today. Thanks to Dan and Kara for your great information. I will hopefully be able to skip over a few things that I planned on talking about, especially around childcare. So I wanted to talk about a few continuing resources that are available to state and local governments. Just quickly on this slide, the CARES Act was the third in a series of federal relief packages, and it was certainly the most robust. And it's the one that included the stimulus payments that went directly to Ohioans. And it has a lot of different funding streams included in it. So I want to spend most of my time talking about resources that are still available, but certainly there were some funding streams that we kept our eyes on that were important to programs that serve the communities and low-income Ohioans. So, shortly after the act passed in March, some of these funds started flowing through local programs and were designated for certain purposes. So the Community Development Block Grant being one had about $90 million flowed to local governments and community action agencies, funds for housing assistance and home energy assistance. Kara talked about some of the Child Care Development Block Grant money that supported providers during the pandemic. So I will not spend too much time on that. There was money that went through the Aging and Disability Services Program, the Ohio Department of Aging, that supported senior nutrition programs, home and community-based supports, and caregiver supports. And then there was some money that went directly to education. K through 12 schools received about $280 million. It's already been distributed. It was on a formula basis to the school districts. Higher education received about $388 million, and that was distributed based on the share of students who received Pell Grants. And half of that money needed to be distributed to students to help them with expenses that were brought on by the spread of COVID. So it's really helped those institutions and students when things were shut down in March and April and May. And Kelsey, if you could go to the next slide. I do want to spend most of the time talking about one big pot of money from the CARES Act, and that's the Coronavirus Relief Fund. This is where the state really had, state and local governments have the most discretion on how to spend the money. Although I think they probably don't think they have a lot of discretion, but we do. The Ohio received about $4.5 billion in, I'm going to call them CRF dollars to make it easier for me to say. So $4.5 billion in CRF dollars. What I have listed under that amount are the eligible purposes that were in the CARES Act. So basically the money needed to be used to cover expenses incurred due to COVID. They could not be used to replace revenue. So I think Dan highlighted some of the decreased revenue experiences of the state and projections into the future. And right now the CRF dollars can't be used to replace that revenue. And it needs to be spent by December 30th, 2020. But what these dollars can be used for, from guidance from the US Treasury and even OBM in the state, is to offset COVID-related costs and purchase PPE. They can support local health departments. They can provide rental and mortgage assistance and utility assistance to unemployed Ohioans. Can provide resources to community organizations to assist with safety and sanitation costs. So those are just some of the ways the money can be used. Next slide, please, Kelsey. So to talk a little bit about how the state has used the money so far. Of the $4.5 billion, the CRF dollars were broken into two pots. A state share and then money that was designated for local governments. So the state allocation was about $2.5 billion, and to date, the state has allocated or designated about $1.4 billion of that money. And I'm a little nervous with Dan being on this, that he's maybe checking my numbers. So I think I'm pretty close, but you can give any updates after I go through my slides. A big chunk of the money has gone to healthcare providers, including behavioral health providers, long-term care facilities, rural hospitals, and this was really meant to help them with revenue losses and increased costs because of the pandemic. The Department of Health received about $194 million to cover testing and lab costs, epidemiologists, nursing home testing, really those response to the needs to address the COVID crisis. Out of this pot of money, there was additional dollars allocated to higher education and K through 12 education. And this was really to assist with them opening this fall. So it was additional money to help schools welcome back their students last month and this month. And probably most recently in the news, included in the K through 12 education pot of money was $50 million for technology grants for K through 12 to make sure that students have access to equipment and internet services. Some of the other uses of the money, you can see they went to other departments, mostly to address the testing, the sanitation, the PPE needs. And there's the child care amount there that Kara referenced, that they used some dollars to support providers to maintain the reduced ratios. So that's what some of the CRF dollars were used for. But the important thing that I want to note is that there is $1.1 billion left for the state to spend. And I think part of waiting on Congress to see if they're doing another relief package and if they might provide some additional flexibility on how this money can be used or extend the timeline for when it can be spent is one of the reasons we see that the state hasn't spent all the money. And certainly our organization and some others have been advocating for this money to be invested to support low-income unemployed Ohioans, including allocating money for rental assistance, utility assistance, and food assistance. So we will continue to advocate that. The governor mentioned in his press conference yesterday that he might be talking more about how he plans to spend this money next week. And then, thank you, Kelsey, to move to the pot of money that is designated for local governments. Like I said, it's about $2 billion of CRF dollars for local governments. The local government jurisdictions that had a population of 500,000 or more got direct allocation from the CARES Act. So you can see it was 5 counties and 1 city met that population threshold, and they received their dollars directly to them. The other local government entities need to rely on the state, either through the controlling board or the legislature, to appropriate that money. Some of the local government money has been allocated through the controlling board to local health departments to assist them with increased costs. So let's turn, Kelsey, to the next slide, and we can talk about how the rest of the local government money is being distributed to local governments. So there's, it's kind of been spaced out in how the money is being appropriated to local government. In June, the General Assembly passed House Bill 481, which appropriated $350 million. It was distributed generally along the lines of the local government fund that the state budget uses, minus those counties that, and the city of Columbus that got a direct allocation. The legislation requires that the local funds be spent or encumbered by October 15th, or it would return to the county and be redistributed to other local government jurisdictions that spent their full allocation. And then finally, it requires that any unspent money be returned to the state by December 28th, 2020. In August, we saw the controlling board appropriated another $175 million to local governments, following the same formula and the same spending time frame as House Bill 481. But that leaves about $650 million that is still sitting for local government use. And Senate Bill 357 is pending right now in the General Assembly, and it appropriates the remaining $650 million. It changes the way local governments would receive the money, and it uses a per capita formula, so it's really more population-based than the local government formula. And it extends the timelines for when the money can be spent. So a little more time to encumber the funds, and then to extends the date to the very end of the CARES Act timeline, December 30th, for when it needs to be spent. So this bill, Senate Bill 357, passed the Senate on September 2nd. And although my slide says it has not been scheduled for a hearing yet, I did get notice this morning that it is scheduled for a hearing Tuesday in the House Finance Committee, so it'll have sponsor testimony and proponent and opponent testimony. So I assume that will move pretty quickly through the process. And I went through all of this to say that the local government jurisdictions, and that includes counties, cities, villages, townships, will be getting more money in the coming weeks. And from our perspective, we also want to encourage the local government jurisdictions to really meet needs in their community and invest in rent, mortgage, utility assistance. We've seen already that both big cities and counties and smaller government entities have already designated some of their coronavirus relief funds or other CARES Act dollars to rental assistance programs and utility assistance programs and assistance with food. You know, Columbus has invested money, Cuyahoga County, Summit County, but also the city of Athens set up a rental assistance program. And just in the last week or so, the city of Portsmouth did, and the village of New Boston. So we are happy to see the communities allocating these CRF dollars to help struggling unemployed families in their communities. We know that the families need this support, and we do hope that there'll be a state level response still from the remaining $1 billion. It's certainly the scale that the state needs to help families who may be facing rent shortages or utility disconnections and are having trouble putting food on the table. And of course, we like to see that supplemented with the local investments from local government entities. And with that, I will turn it back over to you, Kelsey.
All right, thank you so much, Susan. And I'm actually going to turn it over to Danny Carlson, Communications Extraordinaire with Center for Community Solutions, to begin our questions.
Great, thank you, Kelsey. And just a reminder, as you can see on the slide on the screen, a recording and a copy of all of the slides will be available immediately after today's webinar at the web address that's on the screen, comsols.com/webinar COVID state government. Now we're going to get through as many questions as we can and still try to be mindful of our 2 o'clock deadline. So I'm going to start with a question for Dan, but as always, any panelist who wants to chime in and add to the answer, please do. So Dan, you mentioned in your presentation the dispatch piece that said the governor is sort of in a wait and see mode, and you said that that was accurate. So when do you think the governor and we will know for sure what direction the state budget will take?
So I think it'll be a couple more months. As I stated in my presentation, I think September will be really crucial. The $600 unemployment payments stopped at the end of July, and so we've only had, there were remnants of that in the economy into August. So September will really be, I think, the first month that all of that is flushed out. And so we'll kind of see the impact of that beginning in September. I think our internal plan is to kind of use September as another data point, and then our revenue team will kind of look at where we've gone through the first quarter of the state fiscal year and reassess where we are. And then I think the governor will use that to inform decisions probably sometime toward the end of this year. I mean, it's difficult because we have this money in holding, so that's a benefit, but the longer you wait, the worse your options or the fewer the options you have. The money being in a holding account is beneficial because it can't be spent, but it's still, if we wait too long, I think that lessens the number of options we have. So I would expect probably in a few months towards the end of the calendar year, we'll see where we are and reassess at that point.
Great, thank you. Next question to Susan, and I know you addressed this somewhat in your presentation, but we did have some questions about guidance as to what CARES funds can be used for. And this was asked by someone in, it appears, a local city government. So I don't know if there's anything more you can add to that.
Yes. So there are several documents that provide guidance on how the money can be spent, and I can refer generally to where you can find those. Federally, the U.S. or nationally, the U.S. Treasury Department has guidance that they've issued on their website, and there's a series of questions and answers that go with that. The Office of Budget and Management also has a resource page under grants, and they have slides and a recording of a webinar that they did for local government entities. And then I think probably one of the most practical resources I have found is on the County Commissioners Association website. They have guidance for counties on how they can use the money, and it gets to me really specific. And there is a document even suggesting how they can use the money proactively to address needs in their community. So those are the three different places I can refer to guidance on how the money can be spent.
Great, and we can put those resources also on our website under where the webinar is too, since it seems like a couple people are very interested in that. Thank you, Susan.
And if I could just add, my contact information is in the slides. If I can help connect local government officials to other local government officials who have done different types of programming, I'm happy to do that as well.
And we'll try to get at least one question for each of our panelists. Kara, we had a question in the chat box. Will families who are receiving P-EBT assistance who are not otherwise enrolled in SNAP be receiving new P-EBT cards? Some families in the Columbus City Schools community have wondered that as they shredded their cards from the summer, thinking that it would be the end of assistance.
Yep, so anyone that doesn't have their benefit loaded to their SNAP account will actually receive a new card. Those will start to be sent hopefully by the end of next week and then filter out over the following week. But yeah, we said that because we didn't know this was going to happen again, that we didn't tell them up front to keep those cards, so we are going to reissue.
Great, thank you. And so many questions. We're going to, as usual, try to send the unanswered questions to our panelists and try to get some of those questions answered for you, but we are approaching 2 o'clock, so I'm going to turn things back over to Kelsey and Tara to say goodbye and share about information for next week's webinar.
Thanks so much, Danny, and thank you so much to all of our speakers. That was a lot of really great information. I know this is definitely one where I'm gonna be looking back at those slides and kind of digesting how everything is looking for the future. So thank you so much for capturing all of that in our short hour. It always goes so fast. So like Danny said, any remaining questions, we will share those with our speakers and get some responses to them where they're able to and share those with everyone who registered. I want to thank again all of you for joining us today and throughout the series. Thank you to our speakers. Thank you to Danny and Kelsey for keeping all of us on time and organized and all of those things. Thank you. And for next week, we will be looking to some of our federal partners at the Center on Budget and Policy Priorities to cover kind of where things stand with already past COVID relief, I think diminishing potential that there will be new COVID relief in the next few weeks, and then also where things stand with the federal budget. We know that there are some things decided there, but everything hasn't been decided yet, and negotiations are ongoing. So I think we'll have a lot of great updates from those folks at the federal level to provide information to us kind of in the health and human service space, specifically in health, housing, and food access. We'll have experts on those topics joining us next week, next Friday, September 25th at 1 p.m. So we hope to see you all then. You'll all get an email to register, and the information will be available on our website. And thank you again for joining us today. And I will turn it over to Kelsey to say any final parting words.
Great, Tara, thank you so much. And we want to thank you for your time and thank our presenters for their time and efforts in pulling together their presentations this afternoon. We know a lot of time and effort goes into those presentations and planning what information you'd like to share. So we want to thank you one more time. And we would like to wish everyone a happy and safe weekend. And we are excited to see you next week for our federal part of our series on this budget preview. So once again, everyone, please have a great rest of your Friday, and we'll see you next time.